call the school committee meeting of September 9th, 2009 to session. Miss O'Connell and Dr. Quick are unable to join us tonight. Okay. And Kellen Campbell had a commitment also, so she's not able to be with us tonight for student school committee. All right. Our first item would be approval of items by consensus. Mrs. Benton.
Good evening, everyone. Nice to have an audience this evening. First, I'd like to withdraw under new business C6A, alert now procedures, because that really is just for notification. It does not need a vote, so I'll be bringing back a memo to you on that. Okay. And I have 3 items on the consent agenda, the regular session, the minutes of August 26th, executive session minutes not for release, and a request for out-of-state field trip, grade 7, Lost River Gorge in New Hampshire.
Thank you. I'd entertain a motion to approve the meeting regular session minutes of August 26th, the executive session not for release of August 26th, and the approval of a field trip to Lost River Gorge with the New Hampshire for the middle school grade 7. Ooh, I have a friend. Sorry. I'm being little. Do we have a motion? Mr. Higgins, thank you.
I move to approve the meetings for the regular session August 26, 2009, executive session August 26, 2009, not for release, and the out-of-state field trips for Lost River Gorge.
Thank you. Do we have a second? Mrs. Duffy. Any comments or questions? All those in favor? Okay, unanimous, Trish. Thank you. So the student representative will be at the next meeting, and we'll go next to the superintendent's report. Mrs. Benton.
I believe it was Mr. McCalder who started a tradition back his first year here of bringing new staff members to the school committee for the school committee to meet, to get to put a name with faces. And it's this meeting and the next meeting in September are my 2 favorite meetings, because we have a wonderful group of audience that is full of brand new to Wilmington employees that are full with excitement and energy, and I am pleased to introduce them to you this evening. We have half of the group here this evening. I'm going to go by alphabetical order and just ask them to stand up when I speak a little bit about them. And the first one here this evening, Heather Antman. Heather Antman is our system-wide behavioral analyst. She has a Bachelor of Arts degree in psychology from Stonehill College and a Master's of Science in Applied Behavior Analysis from Northeastern University. And this position is funded out of the ARRA grant, and we're thrilled that we were able to have a certified ABA specialist on board who's going to be doing training with staff and consultation. Welcome, Heather. Next, Beth Ann Bronowski comes to us. This is her first position in the Wilmington Public Schools. She will be is a school psychologist, a Bachelor of Arts degree from Williams College, and Bachelor of Arts degree from Williams College, and a Master's of Science in Applied Educational Psychology from Northeastern. Welcome, Beth Ann. Sarah Collins was an ed assistant. You perhaps heard her name last year. She was an ed assistant at the middle school. She has a Bachelor of Arts from Emerson, currently enrolled in a master's program at Simmons College, and is one of the new special ed teachers at the middle school. And I have to say, I'm going to probably embarrass her, but you might know her mom, who is the secretary at the West. Welcome, Sarah. Our next, Christine Duras, speech-language pathologist. She was at the Thomas Mystic Valley Early Intervention Program in Woburn last year, Bachelor of Arts, Lafayette College, and a Master's in Education from the University of Virginia. She will be serving both the Wildwood and the Beltwood populations as speech-language pathologist. Welcome, Christine. Bridget Fleming. Bridget Fleming, this is her first teaching position. She has a Bachelor of Arts from Simmons and a Master's of Science from Simmons as well, and new special ed teacher at the West Intermediate. Welcome, Bridget. Kimberly Hamlin, another teacher at the West. Here she is, special education teacher, Bachelor of Science from Fitchburg State College. Welcome, Kimberly. Diana Cole, new teacher at the middle school, English language arts teacher with a Bachelor of Arts from Bard College and a Master's from Boston University. Welcome. has a great theater background, and in the interview, you could tell right away that the children were going to love her because she had all of the inflection in her voice, and I think it was a great choice. Kelly LaRoche, our new guidance counselor at the middle school, and we are thrilled that Kelly came to us from the Andover Public Schools. She has a Bachelor of Arts from Assumption College and a Master's from Assumption College, and when I met her, I said, what if Andover gets money and recalls you? And she said, no, I am staying and I'm going to hold it to it, because we're thrilled to have her here.
Thank you.
Jennifer Lomer, special ed teacher at Lighthouse School in Chelmsford, comes to us at the middle school in the new, as the alternative ed sped teacher, Bachelor of General Studies from Salem State College. Welcome, Jennifer. Tanya McSorley is was a French teacher at Melrose High School and is a .8 French teacher at the middle school. She comes to us with a Bachelor of Arts and a Master's of Education from UMass. Welcome.
Thank you.
Nathan Melbourne, new mathematics teacher at the middle school, Bachelor of Science and Master's of Education from Boston University. Welcome, Nathan. George Mousakis, I am not going to embarrass you tonight. Welcome. He is our new middle school psychologist. He has a private practice and is a psychotherapist. He's has a Bachelor of Arts from University of Mass Boston, a Master's of Social Work from BC, and a CAGS in School Psychology from Tufts University, and we're thrilled to have him. Welcome, George. Jill Olson is long-term substitute at the middle school, English language, was a long-term substitute at the middle school for 4 months. She's English language arts teacher, a Bachelor of Arts from Bridgewater State College, and I'm proud to say a Wilmington High School graduate. Thank you. Megan Sheehy, new teacher at the high school, mathematics teacher, and boy, we were thrilled because this was a late resignation, and we were thrilled that Megan was interested in relocating from her hometown in New York to come back to Boston because she got her Bachelor's of Arts at Stonehill College to join the teaching staff at Wilmington High. So she had to scrounge around for an apartment right away, and she did it. Now, did I miss anybody who's here this evening? And who am I can't...
Catherine Landau.
Catherine, I apologize, and you are right on the list. Our middle school social studies teacher. Please. Catherine was a social studies teacher in Hamilton last year, and has a Bachelor of Arts from Wheelock and a Master of Arts from Northeastern, and is new social studies teacher on the 8th grade, at the 8th grade level.
7th grade.
7th grade, excuse me. With that one. Welcome.
Thank you.
Thank you.
Thank you.
Did I miss anybody else? We welcome you to the Wilmington Public Schools. Thank you all. And do all the work on all those lesson plans. Thank you.
Thank you all. Thank you. Teachers dismissed.
Exactly.
They're going pretty quickly, too. They have a lot of work tonight.
This half, and we had another half next week,
Yeah.
2 weeks.
That was most.
Now, I did see Doreen before.
She's right here. She's,
Oh.
they're right in the side there. Okay.
I'd like to invite up our head nurse, Doreen Crow, who's going to do a presentation on how we're going to be dealing with the flu season. And Doreen has probably spent more time than she ever wanted to spend with me in the past 2 months. In fact, this afternoon from 3:30 to 5, Paul and Shelley Newhouse from the Board of Health and Doreen and I were doing another phone conference on how schools are dealing with the flu last week. We met with the town manager and the town nurse and Shelley to discuss plans as we move forward. And I have to just take a moment to say that I couldn't be more fortunate to have a head nurse being Doreen Crow, because she is the most responsive person I have ever worked with, quick to respond, thoughtful in her thinking of how to deal with big issues that could be controversial, but keeps, and I'm trying to learn from her, the calm demeanor that Doreen keeps us all feeling good, even when she has to call me and tell me that we have a case of lice at one school or we have something else going on at the other. So without further ado, I'd like to turn it over to our head nurse, Doreen Crow.
Thank you. Thank you, Mrs. Benton. You should have received some handouts in your packets, and we're going to get to that at the end of the presentation, so you can hang on to those for now. And I wanted to note that those are also uploaded onto the school website. So they're already all there for parents to have access to. So I've been asked to come here tonight to talk to you about flu precautions. And so what I want to say is that before the meeting, Mrs. Kane asked if I was busy, and I said I've been busy the whole summer working on the flu and how we're going to deal with it in the schools. So we've been partnering with our Board of Health, and we're very lucky and fortunate to have such a responsive Board of Health to work with us on this. We have attended conferences, had several meetings, and conference calls, as Mrs. Benton mentioned, this past summer and most recently today. The major fact is that H1N1 did not go away over the summer. That is an issue still, and it is anticipated that with the opening of school that there'll be a surge of cases nationally and globally. So what I want to do first is briefly talk about seasonal flu and H1N1 and sort of talk about what each one is and what's different about both of them. And then we'll talk about what our precautions are for the flu, and these are based on the Center for Disease Control recommendations and guidelines, and they're specific for schools. And then we'll end with some additional information, and that will be some resources that are available on the web. So the seasonal flu is also known as the flu or influenza, and it's the flu that we see every year that usually starts around November-ish and then usually ends about March. So when you see people with flu and influenza-like symptoms and it's not that time period, it's not seasonal flu. That's one big way to differentiate between the two. The symptoms include fever, cough, sore throat, runny nose, aches and pains, and in some cases, mostly with children, you'll see nausea, vomiting, and diarrhea. And so some of these symptoms are similar to the common cold, and you can't sometimes tell what the difference is between the two, whether someone has a cold or whether they have the flu. But the fever is usually the key. So one way to protect yourself from the flu is to receive an annual vaccine. And that's usually available starting in the fall. This year, a large effort has been made to provide the flu vaccine earlier. So flu clinics and doctors' offices have already begun immunizing their patients in communities with the flu vaccine. And that's just to get a head start on the whole process. The flu vaccine is available in two formats. It comes as a shot, as an injection, and it comes as the flu mist. Flu mist is available for healthy persons aged 2 to 49 and usually non-pregnant people. So that's the population that can receive that if they choose to. And flu activity, I might add, is highest among school-age children, and so that's why there's a push for making sure that we have some guidelines in place for our schools. The target groups for seasonal flu. Oops. Sorry about that. The target groups for seasonal flu are listed here. So we have the school-age children listed first, pregnant women, people over the age of 50, people with chronic medical conditions, and those would be people that have cardiac disease, pulmonary disease, renal disease, and people that are immunocompromised, those kinds of people. And then the people that are living with or caring for those that are at risk would also be considered a target group. So H1N1, or the swine flu, which it was called when it first came out, is a new type of virus that we first detected last April. It was right after the school vacations had happened. The symptoms are exactly the same as the seasonal flu, but what's different is that H1N1 can occur at any time period, so any time of the year. They're both highly contagious, and they both spread from person to person by direct contact. These are the target groups here for the people that are highly recommended to receive the vaccine. Pregnant women, household contacts, healthcare and emergency medical personnel, and then there's your school-age children right there on that fourth bullet, and then persons 25 through 64 years of age that have high-risk medical conditions. The H1N1 vaccine is currently being manufactured, and they're currently doing clinical studies on that, so we have no idea when that vaccine is going to be available. So the idea is that they hope that there's enough vaccine for everybody, but they would prioritize these groups first and then prioritize that even more if there were less vaccine available. The H1N1 is available only as an injection, and you must receive 2 shots. And they would be given 21 to 28 days apart. And they do expect it to be ready sometime in October. Right now, that's what they're saying, sometime in October. And what you'll notice about the target population here is that people that are 65 years age or older are not included, which is unusual for us to think of it that way because we're so used to making sure that the elderly become vaccinated. And the idea is that they feel that they have some immunity to it, and there weren't many cases of it last year. But there were a lot of cases with the school-aged children, quite a few cases. I believe the number was like 52%. So the CDC has provided us with some school guidelines, and these are for grades K through 12. The best prevention against the flu, I want to say first, is to vaccinate yourself. That would be your best protection, and then we'll talk about what the CDC recommends. Early identification of ill students and staff is really important. I think that if people recognize that they're sick, they need to stay home. Good cough and hand hygiene etiquette are really important. Your first defense against any type of germs is to be washing your hands, because when you're touching and contacting surfaces, that's where the germs are going to be. Isolation and dismissal of students or staff that present with what we call it is ILI, or influenza-like illness, upon arrival or becoming sick during the school day would be important. So if a staff member became sick or a student became sick, we would want to make sure that we isolate them in an area in the school and that we send them home. And there's a picture of a mask on this slide because the recommendation is to put a surgical mask onto the sick person if they can tolerate it, and that helps the spread of germs, because remember, they're going to be coughing if they have the flu. And we don't want those droplets to get onto the surfaces that we're going to be touching. If a sick person cannot tolerate having a mask on, then the recommendation is for the people in the area taking care of that sick person to put a mask on so that they're not coming in contact that way. So Joanne and I have talked about how we're going to isolate children in the schools, and we have the nurse's office, and in some cases there's no separate location in the nurse's office to isolate those children. So we're coming up with a plan for how we can accomplish that.
And we would ask permission.
Yes, thank you for bringing that up. I think it might be a little unsettling to some parents and children, for that matter, to have a mask put on. So the plan is for us, if we had to call and dismiss a child, is to ask the parent over the phone if they mind if we put a mask on their child. So staff and students that are sick with influenza-like illness should go home and not attend school or go into the community for 24 hours. That's really, really important. If we're going to stop the spread of germs, we need to get the people out of work and out of school, and they need to stay home and not go to school activities and not go into the grocery store. But it would be okay if they wanted to go see their doctor, to get in the car and go do that. What's important here, and I asterisk that, is to make sure that the fever and symptoms are gone for 24 hours before returning to school or returning to work. And the fever should be gone without the use of Tylenol or any other type of fever-reducing medicine, which would be ibuprofen or Motrin or Advil. And what you should remember is that body temperature is usually lowest in the morning and can go up at the end of the day. So, if a child has a fever in the evening, you want to wait one more day and make sure that it's gone before sending your child back to school. Aspirin should always be avoided for children under the age of 18, and that's because of Rye syndrome. And parents and staff, this is where we need the help of parents and staff. This is a joint effort. This isn't up to just the school nurses or the teachers. Everybody has to work on this together. We have to partner on this together. That they should monitor their self and their children before sending them to school and before coming into work, and make sure that they're not sick before they go off to school. Communication between school administrators and the local public health officials is key, and schools need to focus on educational activities aimed at promoting ways to reduce the spread of influenza. Mrs. Benton has added flu education to the health curriculum, so that's one way that we can address that. We have always done hand washing education with our students through the school nurses and the health teachers, and so that will continue, and we'll do more work with that. We do have some hand sanitizer stations set up in all of our schools. There's posters all over the place now, and we'll get going on some hand washing education. The new focus this time around will be that the schools will remain open for as long as that is possible. Last year, I don't know if you remember, that the exclusion was for 7 days. Kids were out for a long period of time, and they did close some schools in Massachusetts. And so the focus has changed on that. Routine cleaning is all that is sufficient, and that would be for all of the surfaces that are touchable by the children and people. Viruses can last up to about 8 hours on surfaces. So the packet that you have, that you received, all the handouts that you received are on the school website, so that's the first website that I listed here. And what you should have received is a letter from the Mass Department of Public Health and the Department of Elementary and Secondary Education from the commissioners. That is a nice letter that explains the partnership that's going on between the two departments and what to expect. Then you should have also received a frequently asked H1N1 handout for parents, a flu symptom checklist. And what they mention on the checklist is that a temperature of 100.4 is what would be considered the flu. And our school district policy is that a temperature of 100, the children would be dismissed for that. So we're going to stick with the 100.0 for a fever. And then you would watch for the cough or sore throat with that fever. You also should have a fever fact sheet, which would help some parents for understanding what a fever is and how to check a fever for their child. And then there's a flu what you can do booklet. That's a nice little booklet that we also have hard copies of that will be going home with all of our students in the elementary level. What I'm going to use the school website to also post a flu vaccine information sheet and flu permission forms for when we start our clinics, which will be coming up.
Can you explain
Yep.
the clinics?
Yep. So what I want to say is that what we're going to use the website, since we're paperless, for all of our forms and information. We'll update that as necessary. And so parents should go on, and from time to time, go to the website and check things out and see if anything's changed. What we're going to do is we're going to use the Alert Now messaging system when we want to direct parents to the website, and then they should go there for updated information. And the primary care physicians are administering flu vaccine, but what we are going to do is offer a flu clinic through the schools, and this is going to be a school-located flu clinic. So we've scheduled a clinic on September 23rd from 12 to 3 at the Boutwell School. This is our first half-day CIT day, and the nurses will all be there to administer the vaccine. Right now, at this time, we only have injectable shots available for the kids. The flu mist has not arrived. It could quite possibly arrive last minute. We're not sure about that, but for right now, we know we can offer the flu shot. So what we're going to do is advertise this on the school website. We'll be putting it in the paper, and then the children will have to come with their parent. If any of our students are 18 years of age or older, they can certainly come without a parent as long as they have permission form signed, and they can sign their own consent form.
Can I just interject, Doreen, on this one? We, as I said earlier, Doreen and I met with the town manager and the head of the Board of Health and the town nurse to discuss whether we should be doing this during the school day or not. And I felt strongly that it should not be happening during the school day, and that I felt that young children should have, if I were a parent of a first grader, I would want to be with my child if they were having an injection. So I thought this was a great way to do it, because we know that parents have scheduled that, know that that's a half day for students, so most of them have made plans or are home that day because their children are home. So they'll be able to bring them to the Boutwell School. And it'll give an opportunity for us to do a service to the community, and truly appreciate the fact that our school nurses are willing to pitch in and not take away from the school day. Doreen?
Yep.
My only question on the time is if it's one of our half-days and some of the staff doesn't, do they go until 2:30?
The staff on the Boutwell have been relocated to another.
No, I'm not meaning that.
building.
Staff who have, we have a number of staff members who have children in the system, and if they don't get out till 2:30, I'm not sure they can get back there for 3 o'clock.
This won't be the only clinic that's offered. So remember, you still have your medical home. You have your primary care provider that you can go to for a flu shot. You can come to this clinic, and then the Board of Health will also be offering townwide clinics. They're scheduling one on a Saturday and one on a weekday during the evening. Very good,
Okay.
good question. And so one other thing that, we're promoting flu vaccines, but I want to make it clear that this is totally voluntary, that it's not mandatory. So that's another reason why we're not doing it during the school day as well.
Plus, this is the seasonal.
And this is seasonal.
Yeah,
This is
this is
only
the first
Not
step.
the,
Right.
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 We have to keep that
We
in mind.
can't schedule H1N1 flu clinics right now because we don't have the vaccine in our hands. I would never schedule anything unless we had vaccine.
Oh, absolutely.
So, if I can I?
Sorry, Mr. Casey?
Yeah.
You have another question?
Clinic will be free of charge.
Free of charge, yes.
Yeah,
Very good,
just want to make
thank
that known.
Thank you. And so I just want to end by saying that in order to prevent the spread of the flu, we need to work on this together. We need to have the help of parents. We need to work with staff. We need to work with the community at large. It's all of us that are in this together. And there are 4 simple steps that are listed on this poster that we can all take to prevent the spread of the flu. Get vaccinated, cover your cough, wash your hands, and stay home if you're sick. And like Joanne said, I do want to say thank you to the Board of Health for all their help with partnering with us on this. And we can't leave out the public buildings also. George Hooper has been fabulous with getting our dispensers on the walls for the hand sanitizer, and he'll be hanging some posters in a lot of our bathrooms too. So that ends my presentation. I want to thank you for the opportunity to be here, and I think I passed the couple of websites that were important on there. Those should also be on the school website. It's the CDC site and the Department of Public Health website. Those are really good sites for resources for additional information.
This past week, Doreen and I have been getting emails from parents about what we're doing to stop the spread of germs. And I had an email yesterday morning. I said, boy, is this the time, or this morning, timing perfect about, could we ask parents to bring in, have each student bring in a small container of hand sanitizer and Kleenex. And I said, as a matter of fact, I'm going to be going to the school committee tonight to ask that. And I know, I looked back in the last year in through my notes, and it was a meeting during the budget season where the question came up about students being asked to bring Kleenex from home, and school committee gave the direction, you did not vote that you prefer that we are not asking for children to bring in, that we should be supplying them. I would argue this year is going to be a very different year in that we really have the potential for the spread of infection if we don't not only teach children how to wash their hands often, but have them have the sanitizer right there to do it. And I'm going to ask that you support us sending home a message to asking parents to help us out with it. Interesting enough, and I know that I was at a school the other day that I know that no letter went home about it, but it was kindergartners were getting off the bus with with hand sanitizer, and I thought that was, it was interesting that we're getting the message out that you need to wash your hands a lot. So I'm asking, we are asking for your support tonight on that.
Does anyone have any objection to requesting that the parents have any thoughts about it?
No,
Mrs. Duffy? Yeah, go ahead.
Yeah, I could state that I support, parents don't mind. It's keeping the tissues that are strong enough for a nice, good nose blow and hand sanitizer whenever the classroom teacher finds it necessary, that they do that a couple of times a day and not overuse it, to keep an eye on it, and that parents can support that and help with that. I have no problem with that.
Mr. Marchese?
I only ask that it be voluntary, not, mandated.
All right, no,
Yeah.
voluntary, absolutely. Yeah, good point, absolutely.
Could I ask, what's the difference, or do they, because you don't mention them at all, you know that you have those little packets that you can have and you can wipe with your hands, you get the little squares? They're
Oh.
not the sanitizer in the bottle, but they're those little packets.
Those work
that you-
too, yeah. Yeah, those do work too.
Okay, I was
Yeah.
wondering about that, because I don't see that
Yeah.
talked about.
I think that sanitizer is a little more convenient and probably less messy, and it's what's recommended when you don't have access to water.
Oh, all right.
Mm.
Okay. So I'd say we wouldn't be against it at all. That would be
No.
great. Mr. Marchese?
One last comment. I noticed that you mentioned earlier that they're not recommending to close schools right away. And I'm not saying that we're going to have an outbreak here, but in case something does happen, that's still our decision here at a local level, not a state level, and not the schools closed.
That was brought up today on the telephone conference. It's good that you asked that. In closing schools, we would consult with the local Board of Health at the local level and make that decision jointly.
Okay.
Yes.
So I just want to make sure we're clear. It stays here at the
Yes.
local level.
Yeah.
Okay.
Sounds good. Thank you. Your report was excellent. It was,
Thank you.
I don't think there could be a question left for us.
Thank you, Dory.
That's great. Thank you
Does
so much.
unbelievable. And thanks to all the nurses who are going to be participating in this process. We have a couple here this evening. I'm glad that they're here. They do incredible work.
Thank you.
Now we're going to invite Mr. Harrison up to the hot seat. No, he's got good news for you tonight. We have a report in the first year of the summer sports camp, and I'm going to turn it over to Paul Ruggiero and Ed in a second, but want to congratulate Kevin Walsh and Ed Harrison on a successful first-year program. Maybe Paul
Thank you.
and Eddie can highlight.
Maybe I'll start just some basics. As you know, we ran the athletic camps this summer. There were 7 in total. We grossed about $50,000 in revenue we brought in, and we netted a little over $10,000. And that includes what we call the lost facility fee, which were facility fees we received in prior years when these camps were run privately. So given the dismal weather we encountered for all the weeks, I think, and everything, this being the first time we ran, I thought it was a huge success. I think Ed and Kevin Welch and all the coaches and assistants did a great job pulling this off, especially since it was our first time. We had said there would be some growing pains, some things to learn, and I just think it'll just grow from here. Each year, I think it'll get better and better. So I thought it was really a great effort.
And one of the things, sorry,
This thing is,
I'll let Eddie talk first.
Oh, go ahead, Mr. Harrison.
I thought you were going to ask a question.
No, I was going to point out, because I watched it for the past few years when we had private camps here. What in the past, we've noticed that once students sign up for the first camp and they like it, then they, convince parents to sign up for another. Because each week the rain got heavier and steadier, and I mean, it was like I kept on thinking we're going to be in trouble and we're going to end up in the red. So I was really thrilled to see for the first year out and starting late that it was such a success.
Well, I'd just like to add, because Paul kind of really mentioned a lot, but in the beginning there was quite a bit of organizing and preparation so that when we started, we were off and running, and there wouldn't be any questions, and things would hopefully work out. I can't thank, Paul enough for all the work. I think he probably spent too much time, helping us out so that we started, on the right foot and ended very well. And the way I look at things like this, it's almost similar to running a game. And when you have a game and everything is going fine, it's a lot of times it's because of the preparation that you do beforehand, so that everything does, follow along. And there was quite a bit of preparation. And the best way I can tell you is I had an opportunity to talk to quite a few parents over the 6 weeks that we ran those 7 camps. And every one of them, there wasn't one bad remark. And at the end, when we were, handing out the little trophies and whatnot, and, had an opportunity to address the parents that were there, I told them, I'm looking for, if you have anything to help us improve our program, please let us know. And most of them they said, we just loved the way it went. Didn't have any negatives. And obviously, sometimes you wait until afterwards, but I thought everything went well. Paul and I have talked, quite a bit on this. Kevin Welch and Dennis Ingram was the other one. He was our trainer. He was there every day. He was fantastic. Got involved in a lot of the different sports, helped out. So we were able to, cut some costs. Paul and I have talked about a few things even for next year to tweak some things and, make it even better. And I really think that now that we've run the camp for a year, I think people have seen us that we've done it. I think it's only going to get better. So it was a lot of fun, except for there was a couple of weeks there that were pretty tough with the weather. But I'm telling you, a lot of the kids went out. We had the gym or the outside. A lot of them wanted to stay outside. It was funny, so.
Thank you. Does anyone have any questions or comments about the?
Thanks, Ed.
Mr. Marquez?
Thank you. And we're off and running with the athletics. We started yesterday with the golf. Started with a big victory over Newburyport, which was a big win. We had Aubrey Yavansky, our all-scholastic girl golfer on the boys' team, shot a 39. And that's from the men's teams. That's not from the girls. So she had a great round. It's great. It's going to be a good team this year. Field hockey started today. They tied. And we got tomorrow night. We got girls soccer and football on Friday. So we're off and running.
Great.
All right.
Thank you very much.
Opening football game is Friday
Against
evening?
Melrose, yes. Against Melrose.
Hopefully the weather is not
We're not
correct.
talking that. We don't talk about that. We don't talk about that. I'm looking. Kevin Lemanowitz said that the cold front's going to push that rain right away. So.
All right.
Oh, good.
All right.
Thank you so
Thank you.
much. That's great.
And the last report is Peter, the professional development handbook. I'd just like him to touch on what the theme is and a couple of programs. Peter.
Thank you, Mrs. Benton. I would just say that I know that you've had a chance to look at this. You've heard about some of these pieces before, but 3 things I'd like to highlight. The fact that we do, and I think the superintendent reminds us of this, that we certainly do believe in the research that suggests that student achievement is highest in districts where staff continue to learn, and we believe that's true. And hopefully this handbook communicates that belief. I think, again, we're trying to grow, and the superintendent's leadership for us to grow a culture of continuous learning, that we send the message to teachers that their growth is a journey and certainly not a destination. And the other thing I think that you'll notice if you do take a chance to read through the handbook, there's a term that's used, and I really believe that we adhere to it, and that's job-embedded professional development. And that is, rather than running workshops that may or may not be related to what a teacher or what's important to a teacher, we're using study groups and other kinds of professional development that are related directly to what teachers are doing and the strategies that they're using, the programs that they're using in their classroom. So there has some immediate payoff for those staff members. You will note that on November 2, which is a release day, we're having a very popular speaker in that will continue our, I'm sorry?
Full day, no school. It's not a
Full day.
release day. I don't want the public to
Okay.
get confused.
Yeah,
Okay.
full day, no school day, all professional development. We're going to kick off with an address in the morning by Brian Mull, who's an associate of Allen November. And I think you'll like his metaphor about farming and how technology really came upon the scene and eliminated children from really some very responsible jobs in the family. But now we can use that technology again, today's technology, to have them contributing to what's going on in the classroom in a very worthwhile way. So we're looking forward to Brian's address at 8:30 that morning in the middle school. And then later on, both a morning session, late morning session, 10:30 to 12, and then a 1 o'clock to 2:30 session with our teachers, our administrators, presenting workshops and sharing the ways in which they're making use of technology in their classrooms. And then I think the remainder there, the last two paragraphs, you've heard a lot about the warehouse and the grant that we received last year and the training that we've been able to provide staff and the beginning of our data teams, which you'll be hearing more of in the future. And I think another great initiative, and that's the addition of Mrs. Ippolito as the elementary school's technology integration specialist, really charged with enhancing and increasing the skills of our elementary school teachers. So certainly be willing to answer any questions if you have any.
Any questions? Mrs. Duffy?
No, just a comment. You mentioned that phrase about from farming, we had all that responsibility that our kids used to have, and then we took that away from them because we've gone away from. I have those kids that trying to find that responsible thing for them to do around the house, but finding a way for technology for them to use that to benefit. I thought that was a nice little catch that was in there, and I think some of the other items. It's nice those seminars, and when we had down in November, it kind of just boosts people back up, and we do have a lot of young teachers who are great with technology and sometimes a little more zealous than we're quite ready for. So maybe this will be a nice way to see some of that in action. Great, thank you.
Mr. Marchese?
Yes. Now, all the professional development that we offer is free of charge, obviously, to the teachers.
All of the, I don't know if we could say all of it. There sometimes are options for graduate credit. But there's a no-cost option as well, so we try to certainly provide a tremendous amount of our professional development free of charge.
All right. And does that also include the in-service credit? Because I was just flipping through and I saw the thing for in-service credit.
Yeah.
So when they're actually getting credit while they're teaching and expanding that knowledge?
It's when they're learning. Yes.
Yeah.
Yep. Exactly.
No, it's good.
Yep.
I think it's great.
The in-service credit is a wonderful carrot, and I think the piece in the district's contract that requires teachers to earn 3 credits over a 3-year period really provides some incentive for people to continue their learning.
I think it's great.
I'll just add that, as I say every year, I'm so impressed by our professional development, having come from an area that did not have a strong professional development program. And it is our responsibility under the new ed reform to make it available to everyone, whether you're a foreign language teacher or you're a science teacher or an English teacher. And we do that. And I really commend you because there's so many ways for these teachers to learn and to have something more. And I totally agree with you. When I was in school, and I know Mrs. Duffy right now probably, when someone's taken a course, they start to talk about it in the faculty room, and one thing leads to another, and you're not crabbing or being upset about what's going on. You're excited, enthusiastic, and especially if you have a good course, and you like to share that, and I see that happening here. And the other part that I love is using the teachers to share their knowledge. I think we really are strong in that, and I think that's to be commended by the staff and yourself. And
Certainly was overwhelming, the feedback last year about how much the staff enjoyed attending workshops presented by their peers. Just really overwhelming, and so we're repeating it this year.
That's wonderful. Thank you. What's up, Mr. Higgins?
One more part to that of the teachers teaching at Wilmington University. To Mr. Marchese's, that's why it doesn't cost them for those those seminars. They're actually learning from their peers. And that's a fantastic idea that came about in Wilmington, and it's being nurtured through Wilmington University, and it's just a great piece that helps them learn from their peers, and it doesn't cost them anything, and they get in-service credit for the time that they spend doing it. So, great part.
Thank you. Thank you very much, Dr. McGinn. Okay, is that? That's it. Okay, old business, policy revisions under our finance section.
This is the second time that policies revisions have come forward. Subcommittee of Joan Duffy and Quincy Vale and myself presented last time around, and I just put them in the format of the, how they would look in our policy book.
Okay. Does anyone have any comments on them before we have to do 4 separate motions here? Yeah. Okay. One of the things I'll say while we're still looking is that this is excellent because this is what we're supposed to be doing. We're supposed to keep reviewing our policies and bringing them up on a regular basis. So thank you to Mrs. Duffy and Mr. Vail for your work on these policies. Okay. So I'll make a motion, I'll entertain a motion to approve the revisions to policy DBJ, Budget Transfer Authority. Do we have a motion? Mrs. Duffy.
Motion to approve of the revisions to policy DBJ as presented.
Do we have a second? Mr. Higgins? All those in favor? Unanimous, Trish. Our second motion would be to approve the revisions to policy DD, which is funding proposals and applications. Mrs. Duffy.
Motion to approve the revisions to policy DD as presented.
And a second? Mr. Higgins? Any questions? Yes. All those in favor? Okay, unanimous, Trish. Motion to approve the revisions to policy DJG, which is vendor relations. Mrs. Duffy.
Motion to approve the revisions to policy DJG as presented.
Second, Mr. Higgins. Oh, Mr. Vail, we'll do you next time. You did not get that bug, Mr. Vail, by the way.
There's more of them.
I've killed
Peter, can
Cecil.
you
I've
close
killed
that
Cecil.
door? We're getting eaten
We are
alive
being
up here.
bugged over here in this corner.
Thank you.
Little addition to the night. Okay. All right, we took the motion and had this, okay. All those in favor? Good, thank you. And the last one is move to approve the revisions to policy DK, which is payment procedures. Mrs. Duffy.
Motion to approve the revisions to policy DK as presented.
And the second, Mr. Vail, I promised you that. Okay, Mr. Vail, did you have a question?
Yes, I have a question on the last one.
Okay.
Last time we had discussed the issue where it said that the list would be certified as correct by the superintendent and forwarded to the town auditor for processing, a subsequent payment by the town treasurer. I had brought up the issue that this is putting all the brunt and burden. Yeah, and ask for or designate.
You're right, I forgot it. I apologize.
Because again, I didn't want to have the burden be placed on you to verify that everything was correct.
I apologize, we missed that one.
So
We're
where
going to add
does
designate.
Yeah.
The superintendent or designate.
And then forwarded to the, it's in the second paragraph. Designate. All right, can we still vote on it?
Motion to amend.
Motion to amend.
Motion to amend. Motion to amend policy item DK payment procedures so as to add the superintendent or her designee in the second paragraph.
Thank you.
His or her designee.
His or her designee.
Yeah.
His or her designee.
You're trying to get rid of me?
Hey, we got to be,
Overtime, gotta last.
quality.
Do we have a second?
Second.
Okay, Mr. Marchese. All those in favor? Okay, unanimous, Trish. All right, great, thank you very much.
Just to be clear, that was a
Yes.
vote on the amendment and
Oh.
to approve the policy as
Policy.
amended.
As amended, yeah.
Both, right?
We shortcut. Did it, thank you. Okay, Superintendent Goals.
The second reading of my goals, I apologize, you had the wrong cover sheet. I put a new one on at your tables tonight, had the wrong dates. The work of the superintendent, to me, the most important work is trying to improve and protect the relationship between the classroom teacher and the student. And in order to do that, we need to promote continuous improvement through student learning, and that, to me, translates to the curriculum review cycle, as well as this year we have the NEAS and C accreditation visit coming up in March that we'll be working on, and want to continue to train staff on the data warehouse, how we use data to inform instruction, and you will be hearing, I think it's coming out in 2 weeks when the DESE makes the report. It's the first time now we're going to have longitudinal data on students, and I want us to get that data into the hands of teachers so that they can use the data to help inform their instruction of students. The second, obviously, very important, is around finance and budget, and hope to bring to you a FY11 operating budget that efficiently and effectively addresses the needs of this community. In addition, we're continuing to work towards greater cost effectiveness. We will be coming back in October with a report on the energy audit and next steps around that piece. And we're continuing to work with George Hooper around replacement of light bulbs, energy efficient light bulbs, to save in that area. The third goal has to do with the fourth year of the strategic plan, and we'll be looking to complete the work that was started 4 years ago and start thinking about, which was a great question last time, thinking about what the next strategic plan is going to look like. And the last has to do with facilities and space. We're starting to see uneven numbers, and I will bring in the reports next week, between the two sides of towns as far as the number of students in the schools. And I know that has been always a goal of the school committee, so we'll be doing some enrollment studies to see if there possibly will be a recommendation to move some district lines in order to have the schools be more equitable. And all importantly, we should be hearing soon from the Massachusetts School Building Authority about the status of our request for either a renovation or a new high school. And we have a new representative, a contact, Diane Sullivan, who I spoke with last week, who will be coming forward with a report in the next month about where we stand. So those are my goals.
Great. Any comments or questions? That's terrific. We don't need to vote the goals, but as I told you before, don't lose these. This will be the basis of evaluation, so that's terrific. Thank you. And you know what else? The goals are measurable, and they're right on target for where we're going, and appreciate the hard work that goes into those goals, Mrs. Benton.
Thank you.
Thank you. Okay, we're holding this.
So we're on the MASC.
Okay. New business, 2009 MASC candidate slate. Oh, yeah. I was contacted by Dorothy Presser, who had been nominated for a position. The person above her position can no longer fill it, and so what happened is the entire slate was moving up if 5 school committees will approve that new slate. And so she asked, I work with her in the Division I, and she asked if we would be one of the school committees who would do that for her and for the slate of candidates. These are all really hardworking people who have put in the time on each of these areas, and they go through a tough process of being nominated for their particular role. And they work for the school committees in general. So I would ask you that if we could take a vote to recommend the new slate of officers Ms. Presser will run for president-elect, Ms. Blackwell for vice president, and Ms. Rossetti, candidate for secretary-treasurer. So if I could have a motion to that effect. Thank you, Mrs. Duffy.
Motion to, what is it, to allow Mrs. Kane to, on behalf of the school committee, support for president-elect position for vice president.
Endorse.
Endorse.
They need endorse.
Endorse for president-elect Ellen Holmes for vice.
Oh, sorry. Down here, right in the middle.
I'm in the wrong place. Here we
To
go.
reconcile
I got
with
it.
Ms. Presser.
Okay.
Yeah.
So let me go back and restate my. Ms. Presser for president-elect.
Right.
Ms. Blackwell for vice president.
Yes.
And Ms. Rossetti, candidate for secretary-treasurer.
Okay, do we have a second? Second, Mr. Higgins. Okay, any questions? Mr. Marchese?
This slate is, I'm assuming is running unopposed?
Oh, yes.
Okay,
It
I just
is,
want to
yes.
make sure that we...
Oh, that's a good point.
Okay, so there's an unopposed
Yeah.
slate, so we're just
It's
moving
unopposed
everybody
slate.
up
Yes.
one position.
All
Okay.
right. Excellent. Okay, all those in favor? Great, I'll contact MASC tomorrow and tell them that we voted that.
Okay, we
tonight.
have to either fax or you have to email. They want it in writing.
Yep,
Okay.
I'll email them in the morning. All right, thank you very much. Okay, oh, maybe. Delegations? Yes, we'll take
I
it
took
off.
that off the...
Yeah, yeah. Is Dennis Ingram related to you?
That's with an I, we're with an E.
Oh, okay. Nice. Okay. It's nice to see visitors in the audience, even if they're not delegations. Thank you for coming. Okay. Let me see, before I go to... All right, I'll do it to board members. Board members, questions or comments? Mrs. Duffy?
Nothing at this time.
Okay, Mr. Higgins?
Few things. Welcome everyone back to new school year, and now that you're into it, get to work. This Saturday, the Wilmington Conservation Commission is hosting a Wilmington Town Cleanup Day again. My wife and I have been doing this since they started a few years back. We didn't have it last year. We got rained out. Hopefully we don't get rained out again this year. So, you know, if you have some time Saturday morning, we start out at the Whitfield Elementary School in the parking lot. Usually about 8 o'clock, 9 o'clock. So come on by, grab a trash bag, and help us clean up. That'd be great. And the last thing I'd like to talk about tonight, just real quick, is the president gave a speech yesterday. And I don't want to talk about the speech. What I want to talk about is the 6 or 7 days leading up to the speech and all the debate that was had on both sides, or actually there was more than two sides, because there were feelings and thoughts being brought out from all sides of this issue. And the only thing I can say was that all that debate was phenomenal. It was fantastic. It's a great civics lesson. It's a great opportunity for everyone to talk to their kids and try to give them both sides of the issue of why he should have had the right to speak and why he shouldn't have the right to speak. And never quell the debate. That's what this country was founded on, was the right to question authority, the right to question government. If you believe firmly that something should happen, speak up about it. If you believe firmly that something shouldn't happen, speak up about it, but never quell the debate. If you feel ambivalent about it, say, oh, geez, I really don't care what happens, and someone's really passionate that it should happen, do yourself a favor and listen. Just listen to them. Let them express their opinions, but make them stand by their opinion. Make them give you facts, and don't just accept facts for face value. Make them back it up, and then keep an open mind and give your view on the subject. Maybe you can help change someone's mind. Maybe your mind will be changed. But I was just so impressed with all the debate that happened everywhere. My sister was upset one side, my other sister was upset the other side, and the kids that are all from first grade through high school. My son's a second year in college. The opinions that all of them expressed was amazing, especially the really young ones, who I thought you know, what could they possibly think in the opinions that they had were just pretty insightful, some of them, you know. So I would say, you know, just never quell the debate, never. Encourage it as much as possible. That's it.
Thank you, Mr. Higgins. Interesting. Mr. Marchese?
Mr. Higgins, you running for state senate?
No, I am officially, no.
No, I would first like to say thank you to all the new teachers that came out tonight and welcome all the remaining teachers that we're going to see at the next school committee meeting. I'd like to again thank Mr. Walsh and Mr. Harrison and also Mr. Ruggiero for running a fantastic program this summer, athletic program. I'm looking forward to next summer, so it's a good job this year. So again, thank you very much for all your hard work. And also, last but not least, wash your hands and blow your nose. So stay healthy this year, and I look forward to a happy and healthy school year.
Thank you. Mr. Vail?
I have nothing to add at this time. After that,
What's there left to say? Thank you. And I have no questions or comments tonight. Under other reports, however, that leads me to subcommittees, and we have always in the past had 2 members of the board represent us at a subcommittee, and one of our most important subcommittees has been without a second member, and Mrs. Duffy has graciously agreed tonight to participate, so I'm going to appoint Mrs. Duffy to the Teacher Negotiations Subcommittee so that she can join Mr. Marchese, and that will give us the recommended, what we always do is have 2 members of the subcommittee. So we thank you very much, Mrs. Duffy.
Thank you.
Filling in for us. And correspondence. Mrs. Duffy is going to read a brief correspondence.
We received one correspondence letter this past week. It was from a Belmont parent who sent a letter to the school committee raising an issue over a Shawshene text allowance of her son to go to their school. And that was just the information that came to us.
Good, thank you.
I will enter into the minutes.
Yeah, thank you. Future meeting dates and agenda items, September 23rd, we'll be having our financial report, class size report, and if anyone has anything else that want an agenda, just let us know. I just want to tell you ahead a little bit, the 2 meetings in October are the 14th and October 28th, and then in November, it turns out our meeting dates are holidays. So, because November 11th, but you're not getting out of it that easily. So, what we're going to do is, Mr. Vail will be representing us down at the Cape Conference, but we're going to meet on the 18th. The only other Wednesdays we have are the 4th or the 18th. If we meet on the 4th, there'll only be 1 week between meetings, and that doesn't work for us. So we'll meet on November 18th, and we'll keep you informed, Mr. Vail. Okay.
on Twitter.
We can Twitter.
Momentarily updates every 2 seconds.
Oh, that's a great idea. We'll have a Twitterer in the audience. Twitter for you. Oh, my goodness. I am so far behind in these areas, I have to admit. All right, I'd entertain a motion to adjourn. Mrs. Duffy,
Motion to adjourn.
do we have a second?
Second.
Second, Ms. Marchese. All those in favor? Thank you. Have a great school year. Good night, everybody.